This presentation reviews the history of how people with intellectual disabilities were treated in the past and how that differs from today. My name is Amanda Hundley. I'm the Quality Manager for the ARC Alliance's Supports Coordination Organization. Throughout this presentation, it's important to ask ourselves, how much better are things today? What has history taught us? Learning about the history of the intellectual disability service system and treatment of people with disabilities helps us gain empathy, avoid past mistakes, and move toward a better future. Disclaimer: this presentation uses outdated language within historical context and mentions topics like abuse and mistreatment. The purpose of covering these topics is to gain an understanding of our history and to see the progress the disability service system has made. Starting with the European Middle Ages, life became tough under the feudal systems of the Dark Ages. Much emphasis was put on agriculture, and those that were unable to produce were generally incarcerated. Many individuals were lobotomized to ensure they would be easily controlled. Guardianships became a standard in the 13th century to help with financial matters. There was a distinction between somebody who had an intellectual disability and someone with a mental illness. There were different property rights based on which one someone had. Guardians would always claim someone was crazy or mad in order to gain access to their property. Hospitals and social welfare began to take effect, the oldest being Saint Mary of Bethlehem, which has been around for over 700 years. The hospital had a much less therapeutic setting than today's standards. Oftentimes, those with behavioral concerns were kept in a stockade or whipped and chained. In 1799, the first documented program for people with disabilities was created. This was a skill-based program catered to each child. This program began the movement to educate people with intellectual disabilities, then known as feeble-minded. In the early 1800s, people focused on rehabilitation and reintegration for those with disabilities in America and across the world. In 1817, the first American School for the Deaf opened, which was the first of its kind in the Western world. In 1841, Switzerland opened the first residential program for people with disabilities. The first American public training facility for people with ID opened in 1848. Although these programs were opening, it wasn't all positive. As populations across America increased, ideas shifted to thinking that people with ID could not be integrated or live a normal life. People began to fear those with disabilities and blame them for crime, poverty, and illness. The first private institution was established in Massachusetts. In Pennsylvania, The Polk Center opened in 1893, followed by Pennhurst State School and Hospital in 1903, and Byberry Mental Hospital, later known as Philadelphia State Hospital, in 1907. More information about Pennhurst will be discussed later in this presentation. The mid-1800s through the mid-1900s is described by some as the worst for people with intellectual disabilities due to segregation, incarceration, and eugenics. It was during this time that ID was thought to be the traits of a lesser, more primitive race that had not fully evolved. For example, the term Mongoloid was used to describe a person with Down syndrome. This was the viewpoint of Western European scientists at the time. We now know that these are general feelings of racism. This type of thinking was from books and publications written by scientists and psychologists. Sir Francis Galton, a cousin of Charles Darwin, published Hereditary Genius and Essays in Eugenics. In the early 1900s, psychological testing, such as the Binet intelligence test, was developed, which was used to identify people whose lack of quote-unquote normal intelligence was not apparent. While this improved the identification of people with an intellectual disability, in combination with society's belief at the time of segregating those who appeared different, it also increased their chances of being institutionalized or falsely imprisoned. In 1912, the best-selling book entitled The Kallikak Family, A Study in the Heredity of Feeble-Mindedness by Henry H. Goddard was published, which discussed inheritability of disabilities. Similar publications stated that American immigrants had disabilities. Medicine was interfering with natural selection, and people with disabilities were having more children than valuable people without disabilities. Children with disabilities were kept in workhouses or institutions in the late 1800s in Europe and the United States. With the eugenics movement growing, there was a focus on the hereditary nature of disabilities, which led to wholesale incarceration and segregation. Complete segregation took place for the teaching of children with disabilities. In the United States, in 1907, the Immigration Act forbid immigration of people with disabilities. After World War I and World War II, soldiers returned home with physical disabilities and mental illness, and their families wanted them to be rehabilitated instead of institutionalized. Federal bills were passed after both wars to fund vocational rehabilitation programs. Scientific advances were also being made regarding disabilities. In 1928, research revealed there were multiple causes for mental illness, including intellectual disabilities. In the 1930s and 1940s, metabolic conditions such as PKU and factors such as infection and endocrine disturbances were recognized as being associated with intellectual disabilities. Studies of people in institutions found that more than half of them had parents without an intellectual disability. In 1930, Dr. Abraham Myerson wrote that disabilities occurred in people in every part of society. In the early 1940s, the National Mental Health Foundation exposed abusive conditions in state institutions. This became an important precursor to the deinstitutionalization movement. Because institutions were overcrowded, people with disabilities lived at home with their families, but were still largely isolated from society. These families started raising awareness and advocating for their loved ones with disabilities. Because of these things, people began to look at disabilities differently. In the 1950s and 1960s, it was recognized that the environment plays an important part in social and mental development. An education bill was introduced in 1953 that led to the Right to Education law. On February 5th, 1963, President John F. Kennedy gave a speech about mental health and disabilities. President Kennedy had a sister named Rosemary who had an intellectual disability and was encouraged by his other sister, Eunice, to advocate for disability rights. In 1970, under the Education Act, the 70,000 children with an intellectual disability that had been deemed uneducable received the right to education, and 400 special needs schools were built. The Disabled Person Employment Act of 1970 stated that workshop settings, as well as help in the home, can be established by local authorities. Pennhurst was first called Eastern State Institution for the Feeble-Minded and Epileptic. It opened its doors in 1908. People who were admitted were given a number, not a name. Due to the convenience of institutions, fear of the general public, lack of knowledge and understanding, institutions became custodial warehouses, overcrowded and understaffed. In 1912, Pennhurst was investigated for overcrowding. The solution was to build more buildings. The MHMR Act of 1966 in Pennsylvania was implemented to begin to find and offer services in the community. Suffer the Little Children was a 5-part expose which aired on NBC 10. Bill Baldini reported the story. Prior to this, no one knew of the conditions at Pennhurst. Until the 1970s, institutions were encouraged by doctors and society in general. In Pennsylvania in 1970, over 10,000 people were still placed in state institutions such as Pennhurst. There was still active segregation and sterilizations taking place in these institutions. In 1974, Haldeman versus Pennhurst was taken to court to sue Pennhurst for damages for numerous unexplained injuries that took place over a 10-year period. The lawsuit also sued for improvements to institutions across Pennsylvania. The treatment of residents at Pennhurst were found to be abusive and dangerous, and Pennhurst was ordered to be closed. By 1983, the state began to move people from Pennhurst into community living homes. By 1987, Pennhurst had closed its doors. Pennhurst advocates still work with people that used to live there. They ensure that all of their needs are met and get involved if there are issues regarding people's rights. The Arc of Pennsylvania played an instrumental role in the closing of Pennhurst. We now know and understand that care and support of people in institutional or large settings are inherently limited in their ability to be flexible and provide individualized supports. This chart shows that it's not only better for the people themselves to live in the community instead of an institution, but it's also more cost-effective. Several state centers in Pennsylvania have shut down over the recent years, with people moving from these centers into community homes. Now, in the present day, we have a much more individualized, inclusive approach. Everyday lives is the core philosophy based on self-determination and positive approaches. With the support of family and friends, people themselves decide how to live their lives and what supports they need to do so. Everyone has a choice on how they live. Everyone is different, and supports need to be individualized. Positive Practices in Pennsylvania is composed of state and regional work groups whose focus is to explore ways to meet the needs of individuals who have a developmental disability and a mental health diagnosis. It supports people with disabilities by paying attention to environment, communication, and assessment. Positive Practices works with organizations such as Philadelphia Coordinated Healthcare, PCHC, to ensure that all avenues have been explored. It emphasizes treating all individuals with dignity and respect, getting to know the person and their history, emphasizing importance of communication, assuming all behavior has meaning, and determining the reasons for any concerning behavior. Professionals and staff working in the disabilities service system follow a code of ethics. This includes, but is not limited to, making people feel valued. Only when you value others can other people see the value of your efforts. Listen to opinions, suggestions, put yourself in the other person's shoes, and praise people's efforts. The individuals that are supported by the ID service system have the same rights as anyone else, including taking risks. We should respect all people's rights and choices. Professionals are also trained to recognize rights violations, which include things like not allowing someone to watch a TV show, forbidding someone from having a slice of birthday cake, deleting someone's dating app from their cell phone, or not allowing someone to make a phone call. Many people live at home with their families most of their lives, so their families should be supported to then in turn support their children and adult children. People's choices and decisions should be respected. People should be helped to make informed choices by providing information and possibilities, while also encouraging people to make their own choices. These choices can range from what someone wants to wear that day, to where they want to work, where they want to go on vacation, and what they want to have for dinner. Maintaining relationships, including people's relationships with their families, staff, teachers, neighbors, friends, significant others, and anyone else in that person's life. People with disabilities should have the option to go into the community as much as possible if they choose. People should be supported to do community activities like shopping, dating, sports, continuing their education, and employment. Through things like increased advocacy, self-advocacy, professional and community education, and monitoring by advocates, community members, and governmental entities, we can continue moving forward, making the disabilities system better and improving the lives of people with disabilities across Pennsylvania and beyond.